Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, founder of a revolutionary medical sales training and mentorship program called the Medical Sales Career Builder, and I'm also host of the Medical Sales Podcast. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire world. It doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing and diagnostic lab, you name it, you will learn how to either break into the industry, be a top 10% performer within your role, or climb the corporate ladder. Welcome to the Medical Sales Podcast. And remember, I am a medical sales expert sharing my own opinion about this amazing industry and how it can change your life. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, and today we have with us another special guest, and he goes by the name of Dr. Dan McMahon. Now, this is a very fascinating individual because he has been in the military, he has been on the forefront of surgical technology, and he is a practicing general surgeon. But I mean, I'm serious. The things that he's done are things you absolutely need to learn about. For example, doing surgery in a completely different country with a robot that turned out to be 100% successful and making this commonplace. Don't let me give it away. This is an episode you absolutely want to listen to. He's doing amazing things. He is the definition of innovation. As always, we're doing our best to bring you guests that are doing things differently in the medical sales space. So I really do hope you enjoy this interview. What inspired you to say, you know what, I am going to get on this show?
Good question. I thought it'd be a good opportunity to have a conversation with somebody in the medical device technology, sphere. Over the past few years, I've really started to network in that industry and in that area. And just have really enjoyed having conversations with people in all aspects of medicine, not just clinicians, but engineers working on new technologies and folks on the business and strategy and finance side. It's been a lot of fun.
I believe it. So let's have some fun to kick things off. I was reading some of your articles, and you're clearly a futurist. Take us 10, 15 years out. How is medical sales changing? What's going to be the difference? Please just give us everything.
Yeah, well, that's a good question. I think a good place to start is, interviews just like this. I think, especially post-COVID, it's gotten harder and harder for medical sales representatives to get into the brick and mortar structures of a physician's office, of a hospital, of an ambulatory surgery center. So I think this type of content, folks from medical device and technology companies talking about their products, their platforms, new innovations, I think that'll be the area that has the most influence moving forward, instead of kind of that traditional call point, to a brick and mortar, hospital structure.
So let's talk specifics. So because this is what I'm seeing.
Yeah.
You tell me if what you're seeing. So during COVID, as you pointed out, everyone kind of medical technology companies said, okay, wait a minute, we need to figure out how to continue doing business. And hospitals and clinics said, okay, wait a minute, we're making do through COVID right now. Maybe we don't need to let these guys ever come back. Right. So you had two opposite sides of the coin here. But now in 2024, it looks like we've kind of gotten back to normal for the most part.
Yeah.
And what I see is a lot of healthcare clinics said and physicians said, you know what? It worked for COVID. Maybe we'll let some back, but we really don't need this. And healthcare technology companies are just taking advantage of having that window. But 10 years from now, are you seeing a world where there are no live reps and unless it's a necessary procedure, it's all done through Zoom, or how are you seeing it?
Yeah, I think that human factor will always have to be there, and that's important. Having in my world, in my domain, the operating room, particularly, if a new platform is rolled out, and it's a complex platform with digital and mechanical components, I think it's invaluable to have the representative there in person, helping the clinical team sort of learn the system, train them up, work through early experience with the system, troubleshoot problems. So I think there will always be a place for that. But I think outside of that sort of sphere of influence. More and more of the interaction is going to be digital. It's going to be on LinkedIn. It's going to be through podcasts and interviews. I rarely see these days sales representatives, in the offices, in the clinics. Whereas, it seems like a long time ago now, but when I was a medical student, 20 years ago,
Yeah.
it seemed like every day you were in the office, there was a lunch and there were, pharmaceutical representatives or medical device or technology representatives, in the office having lunch with you, bringing lunch. There's just less and less of that these days.
Right.
So I think those types of sales interactions and the representatives getting their word out, their content out about their new product or medication, it's going to be on, forums like this. It's going to be interviews, podcasts, LinkedIn. I think LinkedIn is a huge resource for companies and folks in medical sales. And I think it's important for them to build their networks on that platform and get their voice heard on LinkedIn and other similar, professional platforms like that.
Could you imagine that LinkedIn became what it is?
It's amazing.
Isn't it just wild?
Yeah, I was fairly anti-social media for a long time. And after getting out of the military, I eased up on that a bit. And I've been on LinkedIn for a couple of years, and it's been an incredible resource for me, expanding my network and just learning. There's so much good content put out on LinkedIn from professionals. It's been incredible. It's a powerful resource, a powerful tool, and I've really enjoyed being on it.
Okay, we're hanging out there because I got things to ask you. But before we get to that, what was the moment, if there is one, if it was that defined, what was the moment where you said, okay, this LinkedIn thing, I clearly need to be here?
Yeah, that's a good question. A little bit about my background and sort of where I'm moving in my career trajectory. And I'm still going to practice clinical medicine, be a general surgeon, but also have aspirations of moving into the business side of medicine and medical technology, medical devices, potentially some entrepreneurial opportunities. And I do some consulting and advisory work on the side in addition to my clinical work. So as I started to really think about doing some of those things, I was encouraged by some others in the network that, hey, build a presence on LinkedIn, build an account, start networking, start interacting. And it didn't take long to realize the value of it. So that was kind of the nidus of me getting started on LinkedIn.
Okay, so it wasn't like you scheduled this one call that was so significant. You said you're doing it from now on. It was a gradual thing for you?
Yeah, it was gradual for me. Yeah, be it, I wasn't an early adopter of social media and technology. I'm a little slow to jump into some of those things. So it was a gradual onset. But once I started building some momentum, it really snowballs. Your network expands exponentially, and you're connected with amazing people, and you can, not cold call, but send a DM to CEOs of massive companies.
Yeah.
They'll get back to you. It's pretty astonishing.
He's like, wow, it actually works. So, as a surgeon, okay, let me set the context. Maybe 5 years ago, 4 or 5 years ago. Yeah. I did a talk to a bunch of surgeons and a bunch of med tech CEOs. And I was explaining to them the power of social media and what it's going to mean for their brands in the future. And at the time, this is still, it's crazy that so much developed in the last 4 years, but this is still like, sure not, as far as medicine's concerned. And one physician piped up and he said, yeah, but we kind of have to get on LinkedIn first. So I don't see how this is going to go anywhere. Right. And, there were a few younger surgeons there that were just saying, no, actually, I've had good experiences. And the older ones were saying, yeah, it's just, this is all just a fad. And here we are. Not only did the ones that said it's only a fad, they have profiles and they're trying to get get larger following the LinkedIn platform now. But coming from a surgeon, where do you see the future of this? Do you think this is going to get to the point where in med school they're teaching physicians that, hey, you're going to have to start building your brand? Speak to that a little bit.
Yeah, that's a good point. I think medical school doesn't do a very good job of teaching medical students the business of healthcare or just any business in general. But I think a lot of physicians are eager to learn about the business of healthcare and the industry of healthcare and how all that fits together. I don't know that they'll embed it in the curriculum, but I do see more and more of the younger generation of physicians, as opposed to kind of the old guard that are nearing retirement age, are really interested in industry and being involved with industry, medical device and technology companies, and being involved with innovations in healthcare in whatever field that they're in. And I think you're seeing them, kind of build their brand on, be it Instagram or LinkedIn or whatever social media platform they like to use. I think it's just a shift. I think it's a shift in culture from one generation to another. And a lot of young physicians, kind of want that side hustle. They want something outside of just their clinical practice, and being involved with industry and getting to know sales reps, when they come to call on them in the hospital or in the office. Obviously, that's a little rare these days, as we discussed, but I think you're seeing that bit of a shift, whereas the older generation didn't really, have that drive to get involved with the industry as much. But nowadays, I think the younger folks are, for sure.
So can you please tell the audience what type of surgeon you are?
Yeah, I'm a general surgeon. So, I do most of my surgery is intra-abdominal surgery. I fix a lot of hernias, take out a lot of gallbladders, bowel resections, whatever kind of emergency general surgery things come up, appendectomy, draining abscesses, and those kind of glamorous things.
The fun stuff. Okay. So, would you say, and of course you don't know these things, but just indulge me.
Yeah.
What percentage of surgeons in your space, general surgery, do you believe live on the LinkedIn platform?
Ooh, that's a good question. I think it's more indexed toward the younger generation.
Sure.
I would say I'd be taking a wild guess,
Yeah,
but I would say all comers general surgeons in the U.S.
Yep.
Probably less than you think, honestly. Probably maybe 25% at
25%.
most.
Okay.
If you shift toward the younger generation, I would think it would be closer to the 50% mark, but there again, I could be way off.
Okay, so on these guesses, could we say that 5 years from now, generally be closer to 50%?
I think so. Yeah,
Okay.
I think it'll certainly rise in the coming years as, again, more of the sort of older generation retire, and that younger crowd starts moving up. Yeah, for sure.
So you're on the Medical Sales Podcast. Think of your typical medical sales rep. Just picture someone in your mind.
Sure.
How valuable do you think it will be for that rep to get on the LinkedIn platform, build an amazing profile, and literally come up with a content strategy that addresses you?
I think it's extremely important, and I think it works both ways. I think it's important for sales reps, medical reps to build that content to bring to the physicians. But I also think in today's age, again, with a lot of physicians wanting to get involved with industry, they need to do the same thing. They need to, figure out what they're passionate about in medicine or surgery, and what they want to work on as far as innovation in the next generation of, surgical tool or medical device, and start generating some content around that. I've done that myself, mostly around soft tissue robotic surgery, which is exploding these days. It's an incredible area of development and innovation. And it's been a lot of fun, just kind of generating some content. I've had, sales representatives and business leaders, folks in the C-suite reach out to me and want to talk and, have meetings and discuss their platform that they're developing and do some product development work and commercialization strategies. So it's been a lot of fun. So I think if you're a physician interested in getting involved with industry, you should certainly do that. And on the other side, the representatives who are building good content will get the attention of those, surgeons or physicians who want to collaborate. And it's, synergistic at that point. It's a great resource for both.
I like percentages, obviously. And staying in the vein of percentages, if you were to think of all the surgeons that just are active and working today, what percentage do you think realize the value of what you've realized on social media?
I think it's a pretty small percentage. At that level, folks, surgeons, physicians who are generating content to get involved with representatives and companies, I think it's probably pretty low. All comers, certainly less than 10% if I had to guess.
Sure, sure. Now, you mentioned networking, and it sounds like for you specifically, social media has really given you an access to industry, which
Mhm.
you've wanted, and especially if you're a big fan of soft tissue robotics, of course you have to be connected to industry.
Yeah.
But you also mentioned that you're getting, I guess, education through the networking as well. So talk
Right.
to us a little bit about that. Would you say that for a surgeon that just wants to be literally informed, the networking is a necessary thing, and maybe you've gotten the kind of education through LinkedIn that has allowed you to make different decisions?
Yeah. I think the more you network, the more access to information and to subject matter experts, key opinion leaders will be, and the more networking and thus access you have, the more content you'll be able to absorb to educate yourself. Even if you don't want to be directly involved with the company or be directly involved with the industry, certainly network and open that network out to a global network even, because there are for example, a lot of soft tissue robotics companies or outside the U.S. companies that are emerging into the market. So broadening your network, broadening your access will bring more material for you to absorb and read and engage with, and thus educate you further.
Okay. So let's talk a little bit about you now. You have quite the pedigree. Let's take it back to the beginning. When you set out to be a physician, what was the mindset there? What was the lifelong ambition? Would you say that you are currently living the dream? I mean, give us the goods.
Yeah, this is a funny one. As a young person, grade school into high school, I never thought I would go into medicine. I was like, that's a lot of school, that's a lot of training. I don't think I'll ever go into medicine.
Sure,
But
sure,
I
sure.
always like science, always like biology and tinkering and using my hands and taking things apart and building things. So I always had that sort of mindset. And I actually went into engineering in undergrad,
Wow.
and for whatever reason, it didn't click. Just wasn't enjoying it. And I said, hey, I'm just gonna try a semester of pre-med classes and see how that goes. And the rest is history.
Right.
Really enjoyed the coursework, what I was learning, was able to engage with it, and decided to go to medical school. Got a military scholarship to go to medical school. Spent 12 years in the Navy. Did all my surgical training in the Navy and had a lot of operational experience, which was a lot of fun. And then been out in academic clinical practice for the last about 4 years now.
4 years.
Yeah.
So you're new to it all, really. You're a baby.
Yeah. Yeah. I finished my surgical training in 2016. So I've
Sure.
been out of training for 8 years. 4 of those years was on active duty in the Navy, and then 4 year in academic practice. So yeah.
Sure. So, I want to shed just a little bit of light on what it means to be an upcoming physician through the military.
Sure.
If you could, and it's going to be kind of a big question, but answer the best you can. If you could just share with us, what is the difference? What kind of impact does coming up through the military and becoming a physician versus not? What does that look like? What does that change for you? What kind of insights does it give you?
Yeah. I was always, growing up, I was always interested in the military. It's always something I had my sights on. And kind of when I found that nice marriage between medicine and the military, it was perfect for me. It's really a fantastic resource if, to speak to the folks that are interested in going to medical school and have any inkling of interest in the military. Really take a good hard look at it because it's a great resource. You can get a scholarship to medical school, so no medical school debt. Usually you get a bonus to join the scholarship program. Tuition is paid for, books are paid for. You get a monthly stipend during medical school, so you can, emerge from medical school with zero debt, go into the military as an officer directly from medical school. And there's just a bunch of amazing opportunities in the military. I traveled the world, got to go out on aircraft carriers, got to fly in fighter jets, got to go on submarines. Again, got to travel the world and
Yeah.
had an amazing time. Learned a lot. You meet some amazing people. Get to work with some amazing people, forge some incredible relationships, and it gives you the opportunity to serve your country.
Yeah.
which I think is a wonderful thing to do. Even if you do it for just a handful of years, we certainly need good, smart, driven folks to be part of our military and serve. And I think it's a wonderful thing.
I think we just made the best military ad you could ask for on a podcast. That is fantastic. Okay, so would you say that having that military experience gave you, gosh, I don't know how to say it, a political insight coming out of the military?
Yeah, I don't know if it gave me any quote unquote political insights, but it opens up your aperture to the rest of the world.
Sure.
Because when you join the military, you're probably going to travel overseas multiple times, and it really gives you a view of what things are like outside the United States. And
Sure.
You go to some places that have are significantly under resourced. And you realize how good we have it here. It's an amazing country, and despite our faults, it's an amazing country. And so I took that away from it for sure. And it also, when you're in the military, you get put in situations where things aren't perfect. You have to kind of make do with what you have. You have to be adaptable, and you have to be flexible. You have to make decisions without all the information you may want or need. So it teaches you how to be a problem solver and a thinker, how to be adaptable, how to be flexible, and you can carry that forward no matter what you go into after your military service. So that's one of the other big takeaways, I think, from military service.
That's awesome. So when in your career then did you start to get into this soft tissue advances? Like what turned you on to that?
Yeah, in my surgical training, general surgery training is a 4-year training process. And surgical robotics was just kind of getting started during my early surgical training. And I really didn't have very much exposure to it at all throughout my surgical training. And then the 4 years I served in the military after my surgical training. And then transitioning out of the military into an academic clinical practice at a university hospital. They had robotic surgery capability there. And I knew it was the next big thing coming up, in the world of surgery, and said, I better get on board with this and, learn how to use this system and get involved with it because it's going to continue to take off. So that was kind of the nexus of me getting involved with soft tissue robotic surgery when I was making that transition out of military medicine to civilian academic medicine. And it's been great. It's an amazing, the intuitive Da Vinci system is the incumbent big, presence in the market.
Yeah.
And that's the system I currently use. But as we mentioned, there's so many companies developing new and innovative surgical robotics platforms that are coming to market globally. And I think it's incumbent upon surgeons, physicians to get involved early to learn about some of these systems that are coming out, to make a decision. Hey, which one of these may be best for my practice, for my department, for my hospital, for my health system? Because there are some great systems coming out. It's not a one size fits all market anymore, I don't think.
Sure.
Intuitive has dominated the market. That's kind of been the one size that has fit everyone because that was the only one on the market for so long. But there's so many new systems coming out that I think can be a nice fit for different segments of the healthcare system. So it's going to be a lot of fun to watch that evolve.
How did you establish yourself as a thought leader in this space?
Yeah, again, just kind of leveraging LinkedIn to grow my network in that space, to learn about the new systems, listen to interviews, listen to podcasts, read articles, go to conferences and interact with folks that I networked with on LinkedIn is really where I kind of gain the knowledge that I have about the soft tissue surgical robotics market. That's been the main source for me, really has been LinkedIn and networking and talking to people and conferences and those kind of things.
I hope you're enjoying today's episode. And I want to let you know our programs cover the entire career of a medical sales professional. From getting into the medical sales industry, to training on how to be a top performer in the medical sales industry, to masterfully navigating your career to executive level leadership. These programs are personalized and customized for your specific career and background, and trained by over 50 experts, including surgeons. Our results speak for ourselves, and we're landing positions for our candidates in less than 120 days in top medical technology companies like Stryker, Medtronic, Merck, Abbott, you name it. Would you run an Ironman race without training and a strategy? You wouldn't. So why are you trying to do the same with a medical sales position? You need training, you need a strategy, and you need to visit evolveyoursuccess.com, fill out the application, schedule some time with one of our account executives, and let's get you into the position that you've always dreamed of. So forgive me if you don't already have one, but I sense you will be the CEO of a major medtech company in the near future.
I hope you're right. I don't know if that's in the cards, but I appreciate that very much. Thank you. And I was thinking about the podcast, what we might be talking about, and we alluded to it a little bit earlier, but that human presence in the operating room from the sales representatives. I think the most glaring example of that for me is when I started using the Da Vinci Xi system.
Sure.
It's a big system.
Yeah.
And frankly, I was intimidated by this thing. How am I going to wrap my head and my hands around using this super complex system? It was very intimidating to me, but we had a great intuitive representative that worked with our hospital, and he knew I was green. Just coming on board and starting robotics for the first time, and he took me under his wing, and he was in the OR with me during probably the first 20 or 30 cases that I did.
Wow.
Helped me, gain some confidence, helped walk me through difficult portions of, the setup and the docking and even the operation itself, because he'd seen probably thousands of robotic surgeries at that point, so he was able to point me in the right direction at certain parts of the operation. It was an incredible collaboration. So I think that human presence is going to be needed, certainly for the foreseeable future with adopting these kind of systems and getting up to speed on them. It was great.
So how long have you been working with medical sales reps? All of your 8 years or more recently?
Yeah, when you start your clinical rotations in medical school, you're going to start having interaction with the clinical sales representatives, be it pharmaceutical companies or med tech, med device, robotics, whatever it may be. You're going to start having interactions with them then. So, I've had interaction with them going all the way back to medical school. In the military, you're a little more sheltered from the sales reps because it's harder for them to get into those military medical treatment facilities with the right credentials and those kind of things. But certainly, since I've been in the civilian academic practice, those interactions have been, more frequent and more involved.
Please share with the audience where you practice right now.
Yeah, I'm in Mobile, Alabama. It's LA, the other LA, Lower Alabama, and at the University of South Alabama, Department of Surgery.
So right now, if a medical sales representative wants to get your attention, introduce himself or herself, introduce their product or service, from everything you've seen, right? You've seen so many different ways of someone getting access to you.
Yeah.
What is the most appreciated way, and what would you also say is the most common way that you've seen?
Yeah, it seems like it used to be the most common way for them to just kind of surprise visit, come into the office and say, hey, can I tell you about this widget, or find you in an operating room and can I show you this? I don't think that's the best way necessarily, because if you're in the OR, busy OR schedule, you're busy in the office seeing patients, you may not be able to carve out 15, 20, 30 minutes to talk with a sales rep. I think the best and most appreciated way is to get in touch with the provider directly or via a secretary that works with that provider. Say, hey, can we carve out 30 minutes or an hour, dedicate some time when you're not busy so we can sit down and talk about, whatever it may be, medication, hernia mesh, some type of instrument, whatever it may be. I think that's the best way to do. And I appreciate it when it's not just a cold call. Out of the blue, they surprise you in the hallway, get ambushed.
You don't like to be ambushed? Why not? Okay, so hold on. We're gonna take this all the way. So in that vein, are you telling me that if you get a request for an appointment, regardless the product, as long as it's used in your space, you will always take the appointment?
Yeah, I'm happy to have a conversation with anyone, and I think most physicians are open to that. But yeah, if you can kind of block an amount of time, so it's protected time, so you're not distracted with clinical issues or the OR. I think that's probably the best and most efficient use of everyone's time and resources. Um, and the other thing that we talked about, use LinkedIn as well. Send a DM on LinkedIn and say, hey, I'm a, you know, local representative or regional representative for this company. We have this product. Can we do a Zoom call, or can I come by the office at some point? Can we block some time to meet? I think that's totally fine, and I think that's also effective.
Mhm. Yeah, because how about this? Would you say that majority of your colleagues have the same? Well, you did just say that you think most surgeons would. Let's
Mm-hmm.
talk about the ones that wouldn't.
Yeah,
Is it LinkedIn? That's the ticket, or would you suggest another way?
yeah. The ones that are not necessarily open to conversations probably aren't on LinkedIn. They're probably just kind of stodgy and set in their ways. So yeah, I think working through an administrator, a department administrator, or a secretary, to try and get in that um, get in that loop, get in that office is probably the best way to do it
Sure,
for some of those other positions who may be a little tougher to crack.
sure. So you've worked with a lot of reps. You've been practicing for enough time to see, I'm sure, the good, the bad, and the ugly. Talk to us a little bit about, what constitutes the most effective rep in your opinion. Well, maybe the top three things.
Right. I think number one is don't be too pushy. Um, I'll just I'll throw that one out there to start. And I see a lot of guys and gals. They're young, they're hungry, they're aggressive, and I can't fault them for that. But be able to read the room. If you've met with somebody a handful of times and they've looked at your product, they say, hey, it's not for me, or it's not for me right now. Maybe I'll change my mind down the road. Don't keep pushing, because you're probably going to turn them off, and that's a way to sort of begin a relationship badly. So one is just get that out of the way first. Don't be too dogged. Don't be too pushy. Sort of know the boundaries. And every physician, every surgeon is going to be a little bit different. They're going to have a little bit different love language. So sort of being emotionally intelligent in that regard, I think, is important. And most are. The other is to be very, very well versed in whatever it is that you're trying to sell. You're trying to get in front of a surgeon or a physician or hospital system. Know the ins and outs of that down to the minutia. You need to be an expert on it, without a doubt. I think those are probably two of the biggest things. And then it's just, kind of general personality things. Be affable. Know the right way to approach different situations.
Sure.
Don't come into an operating room and if it's a tense part of the surgery, then don't try to chime in and give them the elevator pitch during a difficult part of the operation.
Sure.
Wait for the right time to engage or re-engage. Again, you see that sometimes with the more inexperienced
Yeah.
reps, and that's more of a surgical centric part of it. But I think those are some of the most important things.
Got it. How, and I'm sure you get this a lot. How do you see AI playing into what you do now? I mean, we can use the Da Vinci robot, for example, if it's not already
Yeah.
a big part of it. But how do you see AI as we develop this thing? One thing that I love reading about, whether you believe this or not, is singularity, and how from the breakthroughs with Neuralink to some of the other things that are coming, and how rapidly we're advancing in all this. How do you see AI playing into the future for what you do now?
Yeah, that's a great question. And I'll be completely honest. I have no idea. I can make some educated guesses on
Please do.
what
That's what we're here for. We want to hear you out of all people, the most educated. Please.
I think from my standpoint, seeing patients in the office, in the hospital, in the operating rooms, I think probably the first sort of iterative piece of AI you'll see really and it's already happening to some degree, being embedded into the clinical workflows and how I perform surgery and how I decide how to manage patients. It's going to be clinical decision assist tools. The algorithm will gather a patient's vital signs and laboratory data and history and age and gender and all these different objective data points, and there'll be some dialog box that'll pop up on the screen in the electronic medical record and say, with all these different factors that we've analyzed, we think this patient has X, Y, or Z, and we recommend this be the course of action to manage that. You're starting to see some of that roll out in some platforms, so I think that will continue to evolve.
Sure.
In the operating room with a surgical robotics system, for example, again, I think the software will be able to collate a bunch of different data points. It'll be able to identify anatomic structures. It'll be able to compare that to some radiographic imaging study, say a CT scan. It'll interpret CT scan data, and then the patient's anatomy. It'll cross-reference those, and then it'll give you some visual cues to say,
Sure.
okay, here's this blood vessel, or here's this ureter.
Yep.
Guide the carotid dissection, more anteriorly or posterior or whatnot to, avoid that critical structure. It may, highlight it on the screen with, some kind of hologram or something like that. So I think we'll start to see those things.
Sure.
I think the days of a robot performing, surgery through, machine learning, I think those days are a long way off, where you can push a button on a robot and it'll do an appendectomy or it'll do a cholecystectomy. That will probably happen at some point down the road. I think it's a long way away. Maybe I'm
As
wrong,
in not in your lifetime.
I don't know. Things are moving so fast. It could, who the heck knows? I was just at a conference, the Society of Robotic Surgery conference. It was down in Orlando a couple months ago. Fantastic meeting. And there was a lot of talk about telesurgery. So, I think there was an example of a prostatectomy being done from Beijing to Rome, that huge of a distance, with 5G network, limited latency, good communication.
What's the accuracy? What's the success on that? What's the accuracy on that right now?
Yeah, pretty good. On the limited scale that they're doing it, patients are having good outcomes. Surgery's going smoothly. Granted, it's a very, very small scale right now, but I think we'll see that happen before we see a robot, autonomously doing, some task through machine learning. Yeah.
Right. No, I get that. But even that, what you've just mentioned is pretty impressive.
It is.
So I got to take it back to you, the surgeon. What does the future look like? Do you see a world where certain surgeons won't even have to leave the hospital to do surgeries all around the world, or talk to us.
Yeah, I think it's coming. At some point, a surgeon will be able to, sit in his office or sit at a console. Doesn't have to be at a hospital necessarily, but there's a patient in one geographic location, he's at another geographic location, and they say this patient has appendicitis or cholecystitis. There's not a surgeon around. Can you do this remotely? Can we do this have this telesurgery capability? Yeah, I think it's definitely coming. And it'll be interesting to see how that scales over time. But those capabilities are there. The technology's there. Is it practical right now? Not really, no. But will the practicality of it increase in the future? I think it will, and especially for under-resourced areas, more rural areas, countries where there's limited capability, limited physicians. I think leveraging some of those innovations in technology can make an impact in that regard. It's going to take time to scale it, but it's happening. It's coming for sure.
What would you say could be improved the most that this technology we're discussing can address when it comes to being a general surgeon?
Yeah. The one thing that I could see innovation and technology address, and most surgeons and physicians would be happy with, is less paperwork. As simple as that sounds.
That's all physicians. That's not just surgeons. That's every physician out there.
Less time in front of a computer, less time clicking,
right.
clicking with a mouse. I mean, it's less time on the keyboard. It's unbelievable the administrative burden that all physicians and healthcare professionals have to work through. And I'm hoping that technology, innovation, artificial intelligence, and it's happening to some degree on a small scale, will be leveraged to minimize that administrative burden so we can take care of patients. So much time is sucked into administrative tasks, and less and less time is available to take care of patients at the bedside, direct clinical tasks. You walk into a doctor's lounge or a hospital workroom or an outpatient office where the surgeons or physicians are working, and it's you hear keyboards and you hear mouses clicking. That's about it. It's sad. Not a lot of conversations with patients per se. It's more
Sure.
Everybody's sucked into their computer to feed this electronic medical record this information. So I'm hoping technology will bring us back to the bedside and not sucked into the computer. That's kind of ground level low hanging fruit stuff, but I'm hoping that will happen. Technology to sort of eliminate some of those mundane tasks.
Sure.
You walk into a surgical ward or a medical floor, and all the nurses are pushing around these carts that have their laptop and these scanners so they can scan patient bracelets, and they got to scan every medication before they give it, and they're constantly typing on these carts. I just wish they could detach themselves from that equipment and just go to the bedside and take care of patients.
Right.
And I think there'll be solutions that are going to come to the market that'll eliminate some of those things. That's one of the number one things that comes to mind.
Okay. What about the more technical aspect of surgery?
Yeah. There's so many different things going on right now in the surgical sphere. 50, 60, 70 years ago, it was stainless steel instruments, catgut suture, and that's about it. Nowadays there's all kinds of devices and robotic systems and catheters and mesh. I mean, you name it. There's just an unbelievable number of devices and gizmos and gadgets, staplers, and the list goes on and on and on. And it's a great question. What innovation will sort of drive simplicity in the operating room? Again, I think anything that can streamline the workflow in the operating room will be important. One of the things that I've always thought about is, we pull a lot of instrumentation and consumables in the operating room that end up going unused.
Sure.
So we're pulling out all this equipment that costs a lot of money, in some cases, hundreds and thousands of dollars worth of consumables for one simple case. To have some type of data collection system that can interpret what's being used, what is not being used,
Sure.
During certain operations, so we can pare down the stuff that we pull out of the closet, if you will, and then end up just throwing in a trash can or wasting at the end of the case. So streamline the workflow, streamline the materials and the consumables that are being used to make healthcare more efficient and less expensive. That's a whole other conversation. How expensive healthcare is in the United States.
Mm-hmm.
Almost 20% of GDP is spent on healthcare, which is incredible.
Mm-hmm.
That's a huge number to think about. We've got to start decreasing the cost of healthcare somehow. And I think if we consume less and waste less, that's one area where we can make healthcare more affordable and help institutions be more solvent. Because the other side of the coin is about 50% of hospitals in the U.S. are operating at a deficit, which is tough to think about. It's expensive to run a hospital, and if you're using and wasting unnecessary equipment and materials, that drags the balance sheet way down. So, making healthcare more efficient through technology and innovation, I think, is going to be critical moving forward.
And for our audience members that aren't in medical sales, that are trying to be or want to be or in a field that doesn't experience what you're speaking to, walk through an example of wasteful consumable in a procedure.
Yeah, and I think one parallel you could draw is Just think about Toyota. Their sort of Lean Six Sigma type of model, how they have streamlined the efficiency and effectiveness and driving down costs through economy of motion and economy of scale, and using resources appropriately. That's kind of a similar parallel that I can draw, if
Sure.
that makes sense. And if we can do that in healthcare, not just at the hospital level, but the hospital system level, and then we're starting to move the needle a little bit.
Gotcha. You mentioned how you mentioned how the U.S. spends 20% of the GDP on healthcare. It's a big number, like you said. And you also mentioned how you do a lot of traveling as a military individual. Have you seen any countries that do it better, or seen any countries where you said, this is an exemplary way healthcare should be treated, and I think we could learn something if we were to pay attention?
Yeah, that's a fantastic question. I mean, even though healthcare in the U.S. is incredibly expensive, I do think we have probably the best healthcare system in the world. We have really smart doctors, really smart scientists, really smart researchers. Certainly can't beat that. So have I seen anything in other countries that we could leverage here? And I think it goes back to more efficient use of resources. I think other countries in other areas of the world really maximize the efficiency and utilization of their resources. I think that's something we can look at, which we discussed. That would be probably the big thing that stands out at me. I think I forget the statistic, but some staggering number of tests and treatments and therapies are actually unnecessary. I think it's close to a third of tests and treatments and X-rays or CT scans or whatever therapy that are performed in the U.S. are actually not needed. So
really, I mean, so not needed.
Yeah.
What is supposed to be done in those instances?
Yeah. Sometimes nothing at all. A physician will order, say a panel of laboratory tests, 6 or 7 different blood tests, for example. You could probably eliminate 2 or 3 of those that aren't actually needed, aren't going to change the management of that patient. It's just, I'm going to order this panel of labs. That's the way we've always done it. Or I'm going to order this test, this X-ray, just because that's the way we've always done it, instead of kind of critically thinking about, does this patient actually need that test? Is this routine test or therapy actually needed for this patient, instead of just plugging it in and forgetting about it? I know we're getting kind of in the weeds of the economics of healthcare, but I think it's important.
Yeah, no, and that's what we're here for. But when I hear that, I wonder, is some of that driven by the bottom line of the institutions that you need to utilize to create great healthcare, aka insurance companies or the labs themselves that need to charge for their tests? Is some of this additional testing driven by the fact that we live in a capitalistic society, and that's kind of what governs everything?
Yeah, I think so. I think to a degree, because hospitals can charge for every blood test or X-ray. They can get compensated for every little incremental thing that they do. But the question is it needed? And I think companies, lab companies, pharmaceutical companies, medical technology device companies, even if they lose an incremental amount of revenue, most of these big companies are gonna do just fine. So yeah, I think there's a way to make things more efficient, less expensive, and everybody can still come away with a win.
Sure. Well, this has been fantastic, Doctor. For those medical sales reps listening right now, what is the one piece of information you'd love to leave with them?
I would say stay curious, continue learning, continue evolving, because the healthcare market's evolving at a pace that is hard to comprehend. If I was sitting here as a young medical student, and you said this is what the healthcare space is going to look like, in 20 years, with over 200 surgical robotics companies, trying to edge their way into the market. Like, yeah, you're crazy. No way. Maybe there'll be a couple, but over 200. Yeah, I think it's around 200 global robotics companies trying to get into the healthcare. and AI and machine learning and the Internet of Things and
Yeah.
just the explosion of software and digital capability. You know, I didn't think it was going to move this fast, but it certainly has, and it's going to continue to pick up speed. So, I think biggest piece of advice for medical sales representatives is, stay on the leading edge, stay curious, read, and track what's going on, the latest and greatest. Because if you kind of stick your head in the sand, you're going to be too far behind.
Mm-hmm. Can't afford to be the ostrich.
That's correct. Yeah.
Now, I know that, of course, one of your major interests is what we've been discussing, but another interest you have is just that career shift from, busy physician to what the heck do I do now?
Yeah.
On that note, in that vein, what would you share with the fellow surgeons and physicians listening to this episode right now?
Yeah. It's a big, exciting world out there. And if you have any, inkling of interest to get involved with the industry, do it. It doesn't have to be a huge grand scale. And you can continue to practice full time, certainly, and be involved with industry, go to conferences, engage with, industry leaders, engage with representatives, and learn about the new technologies. It's a great way to learn about new platforms and new systems and new products coming to market. So yeah, my advice is to get engaged. And I'm going to continue to practice surgery, as long as I can. But the other side of my career trajectory is, to get involved with the business of healthcare, get involved with med device and technology companies and industry, and do some consulting and advisory work for the medical device and technology industry. And I've done that a little bit. It's been a lot of fun. I've really enjoyed it. I may end up scaling down clinically some and ramping up on the business side, which I would like to do at some point.
All right.
I don't want to completely detach from clinical medicine because I think there's a lot of value there, being actively practicing and being engaged with the medical device and technology industry. You can speak both languages and you're up to speed clinically and you're up to speed on the business element of it. And you're able to bridge that gap between the operating room or the ER or the physician office and the boardroom, of a big company, or even a startup company, a smaller company. So I think there's a lot of value for physicians, for clinicians, for healthcare professionals who want to be involved with industry. Keep practicing, be engaged in clinical medicine, and you bring tremendous value, to the C-suite players, and how they're trying to look at the market, position themselves for the future in the market, bring new and innovative products to their business, to their company. And frankly, if the physicians and clinicians are involved, those products that end up making it to patients, they're going to be better.
Mm-hmm.
They're going to be better products because you've given that direct clinical input and insight to those folks. And I think that's tremendously important.
Fantastic. Where can people find you?
Yeah, you can find me on LinkedIn. Daniel McMahon. I'm not much of an Instagram or a Facebooker, but they can certainly find me on LinkedIn. I started Delta Medical Consulting. It's a medical consulting advisory business I spun up after completing an MBA just recently. Used Uncle Sam's GI Bill to do an MBA, and it was a phenomenal experience at Emory. Mm-hmm. Emory's Good Sweat Business School. That was great. So you can find me on LinkedIn or go to the website, deltamedconsulting.com.
Fantastic. And you know what? Well, real quick, if you were to generalize what you consult on most, like if you want to know about this, you better be reaching out to Dan McMahon. What is it?
Yeah, I think kind of, where I operate most is in the space of obviously surgical technologies. So soft tissue surgical robotics, endoscopy, surgical endoscopy, surgical simulation, any type of surgical technology. That's kind of where I operate most, and most of my experience has been thus far. So that's probably the main niche there.
Fantastic. We got one more thing to do.
Yeah, fire
Dr.
away.
Dan McMahon, before I let you go today. All right. We have what we call the lightning round. I'm going to ask you 4 questions. You have less than 10 seconds to answer. Are you ready?
Let's do it.
All right. What is the best book you've read in the last 6 months?
The Ego is the Enemy by Ryan Holiday.
That's a good one. Yeah,
Good one.
that's a good
Very
one.
good
Yeah,
one.
that's a good one. Okay, okay. Best movie or TV show you watched in the last 6 months?
Uh, my wife and I watched Suits.
Isn't that fantastic? I mean, I just got turned on to that one too. That's a
It's good.
show. Who knew? Okay, okay. We want the restaurant, location, and the name of the item. What is the best meal you've had in the last 6 months?
Blanking on the name of the restaurant. It's in Washington D.C. It's not far from the White House. I'll think of it in a minute. They had a goat cheese ravioli with this lemon butter sauce that just blew me away.
I'm
I
getting
wish I knew
hungry.
the name. I'm blanking on the name of the place. But anyhow, it's a seafood steak place,
Okay.
surf and turf kind of a place. Yeah.
We're going to get that name, folks. It will be in the show notes. Okay. And last but not least, what's the best experience you've had in the last 6 months?
Best experience I've had in the last 6 months. Obviously, any time with family, I cherish it. Got to spend a lot of time with family this summer, which has been wonderful. Professionally, it's probably going to the Society of Robotic Surgery conference down in Orlando. Wonderful conference. People there from all over the world, industry sponsors, physicians, folks from the finance sector. Just a wonderful marriage of people and minds, and seeing some of the new robotic systems coming to market. It's empowering and it's exciting, and a lot of smart people working on it. So I highly recommend the conference. It's in, where is it next year? Strasbourg, France next year,
Nice.
which will be a great venue.
Nice. Dr. Dan McMahon, it was fantastic spending time with you today and learning so much about all the wonderful things you're working on. We can't wait to see the things you continue to produce. And thank you for being on the Medical Sales Podcast.
Thanks so much. I enjoyed the conversation. Hopefully we can do it again some other time.
Absolutely.
Thanks, Samuel.
And that was Dr. Dan McMahon. Fascinating stuff, right? Can you imagine doing surgeries in California and having all kinds of success rates in maybe 4 or 5 different countries because of all the surgeries you did in one day? It's a future that's hard to imagine, but as he said, there was once upon a time he couldn't even imagine there'd be as many surgical companies in the AI space as there are. And what we didn't share is that they're springing up daily. So there's 200 now, there'll probably be 300 by next year. It's a fascinating time, and everything's happening exponentially. And this is the kind of stuff you get to be involved with in the medical sales space. So if you're someone that wants to get into medical sales, I know you were fascinated with what you heard, and you're like, wait a minute, how do I get there? How do I start to sell a Da Vinci robot and train a surgeon on how to use it? Well, you do that by visiting evolveyoursuccess.com, filling out an application, give us some information, and let's get you on a call with one of our account executives and get you into a position. And then if you are someone who wants to increase your medical sales, you're in the field right now and you're thinking to yourself, I'm ready to level up. There are things that I know I should be doing that I'm not, but I'm not quite sure where to get that resource and that help. Again, visit evolveyoursuccess.com, check out our page on sales training, send us some information, and let's get you on a call and get you to where you want to be. As always, we're doing our best to bring you guests. We're doing things differently in the medical sales space. So make sure you tune in next week for another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a customized and personalized program that gets you into the medical technology industry as a sales professional, or any type of role for that matter. Become a top performer in your position and masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolveyoursuccess.com by visiting our site, filling out an application, schedule some time with one of our account executives, and allowing us to get you where you need to be. Stay tuned for more awesome content with amazing interviews on the Medical Sales Podcast.